Lisa, and Dr. Manning, this is Dr. Marcel.
Right.
Belly radiating.
Radiating, not a lay term. Your doctor?
No, professional patient.
You mind if I lift your gown?
Scars on your abdomen, laparoscopic boards?
Appendix, gallbladder, all gone.
Okay, I'm gonna... fullness in the pelvis. All right, we're gonna do an ultrasound, okay?
Can't see anything. Bladder's huge and in the way. Lisa, when was the last time you urinated?
I don't know. Yesterday, I think.
Well, pain could be coming from urinary retention. Foley? We're gonna drain your bladder. Should help with the pain, okay?
I'll get you some meds too, all right?
My bag. Grab what's inside.
What is all this?
My medical records.
Hi. So we got your initial lab results back, and it was normal all across the board.
Sorry, normal's usually good news.
I let myself get my hopes up. Shouldn't have done that. Volume 7 of my 16-year war with abdominal pain. All I know, it's not IBS or endometriosis or interstitial cystitis, kidney stones, pancreatitis, bowel obstruction. It hurts the worst right here. There has to be a reason. But I have been poked, prodded, scanned, cut open, and no one ever finds anything.
Lisa, I can't even imagine your frustration.
But I don't need sympathy. I need you to fix me.
We'll do our best. Fortunately, that does require more pokes, rods, x-rays, scans.
Have at it.
Okay. Is that Lisa's latest test results?
Yes. The labs are all normal. Same with the KUB and transvaginal ultrasound. Next up is the CT.
I'll squeeze that into my locker and meet you upstairs.
Sharon. They just ended loose a small bowel. Could be a partial obstruction.
I'm not sure. If it were an obstruction, I'd expect the bowel to be a lot more dilated than it is.
So what, we just agree to disagree? I mean, that doesn't help her.
Damn it, I know something's causing her pain. It's in there. Just don't know what it is. Can't see it.
Kira, build this scan into a high-res 3D rendering. Focus on the left flank where her pain is the worst.
Well, how about that?
Renal vein is compressed. And it looks like it's causing significant left-sided venous congestion. That isn't just painful.
It's excruciating.
The renal vein is being compressed?
It's called Nutcracker Syndrome because the pain feels like you're being squeezed by a nutcracker.
All this time. Right there. How'd all the other doctors miss it?
It hides. Only get to about ruling out everything else first.
I'm relieved to finally have an answer, but my pain, it's more than a squeeze. I'm being crushed by a car compactor.
Yes, we suspect a compounding issue, a second disorder affecting the ureter, loin pain hematuria syndrome.
So misery on top of agony. What's the fix?
Surgery. There are two options. First is a renal vein transposition. It'll relieve the Nutcracker syndrome. Unfortunately, it may not do anything for the loin pain.
Option 2?
Embolize the renal artery. This will help with the loin pain, but may aggravate the Nutcracker.
So let's do both.
The thing is, you can't do both. Together, they would put too much stress on the kidney's blood supply. The organ would fail.
Then no. To both options. Neither ends my pain, so what's the point?
Less pain could make a huge difference in your life.
Zero pain is something. Everything else is just history repeating itself, procedure after procedure, all of them colossal failures. I can't take another one. I will lose my mind. I am always going to live in pain. It's just time that I accept that.
Next. Well, I've been hitting your dead ends. You got something?
Yeah, I think so. Kidney's at the center of Lisa's pain problems, right? There's not enough space for the blood and urine to flow smoothly. So, what if I were to move it to a place where there is?
That's a massive undertaking. I mean, if you're willing to go that far, why not just remove the kidney altogether? Less risk of complications.
Possibly. There'd be a huge trade-off. She'd be losing a perfectly healthy organ. I mean, look, if there were a better option, I'd be all over it. I'm not seeing one.
A kidney transplant?
A kidney auto transplant. It's more like a relocation.
The new positioning decompresses the renal vein, so there's no more pressure on the ureter. So it both addresses the nutcracker and the loin pain.
I've been let down so many times. You sure this will work?
The theory is sound.
Look, I believe it will work.
Okay. I'll hope.
Okay. Hey.
Hey.
So Lisa's gonna be sore for a while from the procedure? For the pain? No more.
That is fantastic. I was worried she was going to have to add us to her list of failures.
Yeah, I was too. You pulled it off. We're a good team.